Avian influenza is a viral infection found in domestic poultry and a wide range of other birds. In poultry, low pathogenicity strains can cause subclinical infections. However, some strains typically cause respiratory signs or decreased egg production. Highly pathogenic strains may cause widespread organ failure and sudden death, often with high mortality rates. Two clinical types of avian influenza occur in poultry: a low pathogenicity form low-pathogenicity, as subclinical infections, respiratory disease, or decreased egg production, and a highly pathogenic form high-pathogenicity, as severe systemic disease with multiple organ failure and high mortality rates. AI viruses are further divided into 16 hemagglutinin H1H16 and 9 neuraminidase N1 and 9 subtypes. The incubation period of AI viruses is highly variable, ranging from a few days in individual birds to 2 weeks in a flock. Zoonotic infections are rare but have been reported in humans without clinical signs, or accompanied by conjunctivitis, respiratory disease, or multiple organ failure and death. Infection with low-pathogenicity viruses typically produces respiratory signs such as sneezing, coughing, ocular and nasal discharge, and swollen infraorbital sinuses in poultry. Lesions in the respiratory tract typically include congestion and inflammation of the trachea and lungs. In layers and breeders, signs of avian influenza may include decreased egg production or infertility, ova rupture evidenced by yolk in the abdominal cavity or involution, or mucosal edema and inflammatory exudates in the lumen of the oviduct. In peracute cases, clinical signs or gross lesions of avian influenza may be lacking before death. In acute cases, however, lesions may include cyanosis and edema of the head, comb, wattle, and snood turkey, ischemic necrosis of the comb, wattles, or snood, edema and red discoloration of the shanks and feet due to subcutaneous ecchymotic hemorrhages, petechial hemorrhages on visceral organs and in muscles, and blood-tinged oral and nasal discharges. In severely affected birds, greenish diarrhea is common. Diagnosis of avian influenza. Detection of AI viral RNA. Detection of AI-specific antibodies. AI virus isolation. Low-pathogenicity and high-pathogenicity viruses can be readily isolated from oropharyngeal and cloacal swabs and, in the case of high-pathogenicity viruses, from many internal organs. Treatment of avian influenza. Antimicrobials against secondary pathogens. Supportive care. Treating low-pathogenicity-affected flocks with broad-spectrum antimicrobials to control secondary pathogens and increasing house temperatures may decrease morbidity and mortality rates. Treatment with antiviral compounds is not approved or recommended. Prevention of avian influenza. Exclusion biosecurity strategies to prevent the introduction of avian influenza into poultry are the best preventive measures. Antigenically matched and properly administered vaccines can prevent AI infections, clinical signs, and death.